Health Watch, it appears that the holiday season isn't just spreading good cheer. Respiratory illnesses are ramping up in the U.S.
The doctors say it's due to a new flu virus variant.
Well, it appears that the holiday season is spreading more than just good cheer. Respiratory illnesses are ramping up in the U.S., fueled by a new flu virus variant.
All right, the holiday season, though, is spreading more than good cheer, fueled by a new variant. Respiratory illnesses are rising through the U.S. As Mandy Gaither reports, this respiratory virus season could be a lot like last year's.
What is up, everyone? It's RD coming back at you once again with some more unwatchable content and yet another video that no one is gonna watch. But if you're one of the regular offenders who has tuned in to this latest installment of #unwatchable content, we are once again talking about Subclade K. It is a story that I've been following for the last 3 or 4 weeks since I sort of was made aware of it as a breaking story, and we've sort of covered it here over the course of those 4 weeks as it has developed and has grown and begun to spread into various countries and into various states. In our latest or in the last upload, we did see that there has already been some closures of schools in the United Kingdom and within the United States, and we've also heard that there are some mask mandatory implementations been put in place as a preemptive measure to prevent the spread of this variant mutant strain of influenza, Subclade K, that you regular offenders should be all too familiar with if you have been tuning in to my recent uploads on this topic. Now, the reason for this latest update on Subclade K is within the last couple of days, there are coming lots of reports out of the United States that this is beginning to spread. It has already been declared a severe scenario in New York City, as well as a high risk in several other states, including Illinois, New York State, which we'll get into within this presentation. And within the last hour, at time of recording, there has been a word from the World Health Organization from their preemptive pandemic preparedness department. So, you know, the last video was titled "It's starting to look or was starting to sound a lot like COVID." Can't remember the exact title now, but it was something along those lines, as we are in the holiday season. And in this latest bunch of articles and videos you're gonna experience, listen to and watch in the coming hour or so of this presentation, you're gonna be hearing an awful lot about the holiday season and traveling and ways that we can combat this spread of the virus. And as I said, guys, you may have just seen those first few clips that opened this unwatchable video, that lots of the agencies are beginning to speak from the sound of the same script on the topic of Subclade K. So we do have a bunch of videos that have been uploaded to YouTube within the last day regarding this subject, including word from the United Nations as well as the World Health Organization. Now, you know, I am predicting that this is gonna develop into a pandemic of sorts come the new year. I think once sort of Christmas is out the way and January is in, which is really when the sort of flu season officially begins, we are gonna see this develop into something very, very similar to we witnessed back in 2020 with COVID, because it was around sort of November, December time 2019 that we first started hearing of this mutant strain of coronavirus that was causing problems in certain parts of the world. We know how that story went in the draconian measures that were put in place to prevent that. Are we about to have a repeat? It's certainly starting to look as though we're in store for something come the new year. I don't want to be alarmist. I don't want to be telling you to go out and do unnecessary things, but I am telling you to be a little bit aware. Keep your eye on this story. There aren't many people outside of the mainstream like I am talking about this topic. And talking of which, which I do have to bring you a comment. I don't know if you can see my phone here, from Ruth Elizabeth, my former neighbour east of Yonge up there in Toronto, where I used to reside before moving south of the border into Mexico, where we've also had our first report of Subclade K as a case here in Mexico. But a comment, thank you very much. I always love getting contextual comments, and this one is from Ruth Elizabeth regarding Subclade K, and she watched and tuned into that last upload I did on the topic, and I sort of asked, let me know if any of you out there are hearing your friends or neighbours, people at work, people at school, or what is the word on the street where you are. I want to hear if anything is being talked about in your neck of the woods. And Ruth said that she happened to go to a baby shower last weekend, and only one person mentioned the virus, so she is guessing that in Canada they are not flashing the fear porn over and over again yet. And as you will see in the videos we're about to see, that the fear is beginning to be repeated over and over again. So as I said, guys, we've got some videos to watch and some articles. I'm going to give you all the videos to watch first, and then we're going to get into the articles, and this will be done within an hour. So with all that being said, let's head over to what the mainstream is saying about Subclade K.
The CDC is saying that seasonal flu and RSV activity is really on the rise. We've got to look out for it. Colorado, Louisiana, New Jersey, and New York getting hit badly, but New York City is seeing the highest in the nation just in time for the holiday tourist rush, too. News Nation's Alicia Nieves is tracking this one for us from Manhattan. Alicia, some folks are calling this a super flu.
Yeah, good morning, Anna. I mean, New York City dealing with some of the highest cases around the country in terms of the number of people who are getting the flu here. I mean, according to the CDC, right now, the first week of December, we saw 14,000 cases of the flu here in New York City. That's a dramatic increase from the same time last year, which only saw about 2,500 cases. Now, flu season has also come early this year, really making its mark around the globe. And doctors are warning it could be particularly nasty because of the new mutated version of the virus that is circulating called Subclade K. Now, some are calling it the superflu, as you mentioned, and with New York being a major travel hub during the holiday season, New Yorkers are getting hit pretty hard.
We see the sudden spike in New York because of their more dense population, their center for international as well as domestic travel. 100,000 Americans died last year from a very robust influenza season. There are prevention methods such as vaccines, immunotherapy that can help prevent complications.
Yeah, and Anna, medical experts are warning that we've not seen the worst yet, since we're only at the very beginning of what's considered the peak of flu season. So a lot of caution out there, not just here in New York City, but really around the country, Anna.
Yeah, good reminder always this time of year. We got to wash our hands, stay home from work. If we're sick, keep the kids home from school if they're sick. Dr. Wu mentioned vaccines there, too.
Yeah.
What else are health officials recommending, Alicia?
Yeah, and I mean, some health officials are a little concerned about vaccines right now and their effectiveness in terms of against this really mutated and intense flu that's going around. So they are, though, still hoping and urging people to do things like you mentioned there a moment ago, wash your hands diligently. Also, still get the flu vaccine. The chances that it could kind of, curb some of the symptoms here are significant. They're saying it's important to just remind you to cover your nose, or your cough and sneezing. Wash your hands again. Just do that frequently, not just when you're using the restroom, but if you're touching a lot of different surfaces, particularly outside. And as you mentioned, if you're sick, avoid contact with other people, stay home, do your very best to be home for at least 24 hours. A lot of it common sense, but it's common sense just with some little extra diligence, giving kind of the intensity of this year's flu, or some are calling the super flu, Anna.
Yeah, and following the pandemic, we've learned so many creative ways where we can work from home. So I guess that's one advantage. Alicia, thank you so much.
All right, so here's what you need to know. If you're hearing a lot more sniffling and sneezing,
scoot away from the person.
Last night around town, you are not alone. Flu cases are on the rise in Texas. Good evening, I'm Steve Eager.
Hi, everybody, I'm Heather Hayes. So medical experts are tracking a new variant that they say is going around. Let's check in with Fox 4's Alex Boyer live with those details. Hey, Alex.
Hey guys, we're here at Parkland Hospital, and I can tell you the doctors that I spoke to here are certainly seeing a slight uptick in the number of positive flu cases here and across Dallas County. As you mentioned, that new mutation that's actually known as Subclade K is largely to blame. Meanwhile, at the same time, the Dallas County Health and Human Services Director is really urging folks who haven't done so already to get their flu shot. May have noticed more people out sick lately. Turns out a new flu strain that's circulating may be partly to blame.
There's an influenza A virus called H3N2, which is very common. Subclade K is a very minor variant of the H3N2 virus. Dr. Cesar Termulo is with Parkland Hospital. At a briefing before Dallas County Commissioners Tuesday, DCHHS Director Dr. Philip Wong said Texas currently is in the lower to moderate flu activity level, far from what we expect during the peak of flu season. About 3.9% of the flu tests have been coming back positive, with the latest week ending November 29th. That's the most recent public data available. So flu activity could actually be higher, given that many people traveled across the country during Thanksgiving, where flu cases in some area have been higher. The new flu variant is responsible for 89% of flu viruses tested by the CDC.
If you look at that chart on the upper right, the 2025-2026 line, you can see it's starting to make that uptick, but it's certainly not where we certainly see when the activity gets more sort of higher burden in the community.
I asked Dr. Termulo what he's seen in his clinics.
So the same things that you see with a regular flu, such as high fever, muscle aches, pneumonias, asthma attacks, things like that is not undifferent to what we normally see with the flu. And so the clinical presentation at this point looks the same.
Dr. Termulo encourages folks to continue to do all the things that we've been taught. Wash your hands, cover your mouth when coughing and sneezing, wear a mask if you're sick, and get the flu shot if you haven't done so already.
What's going to happen is that with the holidays, people are going to be getting together. A lot of people are going to be in close contact with each other. So oftentimes what we do see after the holidays, especially in January, we do see an uptick with influenza activity.
So to that point again, Dr. Termulo says it takes about a week or so for your body to build up those antibodies after getting the flu vaccine. And he really wants to drive home the point that it can help decrease your chances of being hospitalized should you get a bad case of the flu. So again, bottom line is now is the time to act. Back to you.
All right, Alex Boye, thank you very much.
On the Health Watch, it appears that the holiday season isn't just spreading good cheer. Respiratory illnesses are ramping up in the U.S.
And doctors say it's due to a new flu virus variant. They say this new variant called Subclade K is driving most infections, and the U.S. will likely see a pretty severe flu season. Doctors say this year's flu vaccine is a good match for two major strains, and while the new strain may reduce some protection, they say the vaccine will still help prevent severe illness.
All right, the holiday season, though, is spreading more than good cheer, fueled by a new variant. Respiratory illnesses are rising through the U.S. As Mandy Gaither reports, this respiratory virus season could be a lot like last year's.
The holidays are here, and so is respiratory illness season, with 3 influenza viruses circulating in the U.S., the new variant Subclade K driving most infections.
And we're seeing a lot of influenza cases increasing across the country, and that's a trend that we're sure will continue into the new year.
Andrew Pakosh with Johns Hopkins Bloomberg School of Public Health says the U.S. will likely see a pretty severe influenza season. Some states are already seeing high levels of the virus, but he says the new variant makes it likely for every state to have high flu case numbers in the next 2 to 3 months.
Whether we're simply seeing more cases because this Clade K influenza virus is evading immunity and therefore more people are susceptible to infection, or if it's really causing more severe disease on a case-by-case basis.
Meanwhile, Pakosh says numbers of COVID-19 cases are nowhere near what we've seen in prior years, but this virus sometimes increases midwinter, and RSV levels have also been low.
It's not clear exactly why, but but 2 strong RSV seasons combined with new RSV vaccines and treatments may all be contributing to that reduced case number.
Pakosh says vaccination is still the best way to protect against severe disease for all of these respiratory viruses. He says the flu vaccine is a good match for 2 strains of the virus, but may evade some, but not all, vaccine-induced protection.
It is certainly not too late, especially as we're thinking about holiday gatherings and travel.
For Health Minute, I'm Mandy Gaither.
Well, it appears that the holiday season is spreading more than just good cheer. Respiratory illnesses are ramping up in the U.S., fueled by a new flu virus variant. In our HealthCast today, we're looking at the latest data and why experts worry this season could be really bad. The holidays are here, and so is respiratory illness season, with 3 influenza viruses circulating in the U.S. The new variant, Subclade K, is driving most infections.
And we're seeing a lot of influenza cases increasing across the country, and that's a trend that we're sure will continue into the new year.
Andrew Pakosh with Johns Hopkins Public Health says the U.S. will likely see a pretty severe flu season. Some states are already seeing high levels of the virus, but he says the new variant makes it likely for every state to have high flu case numbers in the next 2 to 3 months.
Whether we're simply seeing more cases because this Clade K influenza virus is evading immunity and therefore more people are susceptible to infection, or if it's really causing more severe disease on a case-by-case basis.
Meanwhile, experts say numbers of cases of COVID-19 are nowhere near what we've seen in the past, but this virus sometimes increases midwinter, and RSV levels are also pretty low.
It's not clear exactly why, but 2 strong RSV seasons combined with new RSV vaccines and treatments may all be contributing to that reduced case number.
Pakosh says vaccination is still the best way to protect against severe disease for all of these respiratory viruses. He says the flu vaccine is a good match for 2 strains of the virus, but may evade some, but not all, vaccine-induced protection.
It is certainly not too late, especially as we're thinking about holiday gatherings and travel.
According to the CDC, the first full week after the Thanksgiving holiday, doctor visits for symptoms including fevers and coughs and sore throats rose more than 3%.
There's still time, definitely before the holidays, to get the vaccine to allow your body to have a degree of defense.
Doctors concerned tonight over skyrocketing flu cases here in Connecticut.
And they are pushing for people to get their flu shot before Christmas. But there is some vaccine hesitancy in the country. Your reporter Dylan Farron is live in Middletown with more on why cases are surging right now. Dylan.
Well, Mark, Aaron, part of it is this new aggressive strain of the flu, but the numbers don't lie tonight. Fewer people are getting their flu shots this year.
I'm more vaccinated than my cat.
I know, yes, I know.
I keep up with all of it.
Yeah. Running errands in Middletown, Ann Eyrich says it was a no-brainer to get a flu shot in the fall. She's hoping others get theirs before Christmas.
Let the doctors and the scientists figure it out. That's all I got to say.
Dr. Husnain Kermali is the chief medical officer at St. Mary's Hospital in Waterbury. He's seeing an increase in flu cases and hospitalizations.
I think we're getting together more, which is a good thing for society. Unfortunately, I think we're also dealing with viruses which mutate.
The new aggressive strain of the flu, Subclade K, is spreading all over the country and may evade the vaccine, which was developed before the variant emerged. According to the Department of Public Health, in the first 2 weeks of December, there have been more than 1,800 reported influenza cases, compared to just over 250 last year. That's a 606% increase. Doctors are also worried about vaccine hesitancy, a lack of trust in safety and effectiveness. CDC data shows flu shot numbers have been decreasing every year since the pandemic.
I believe that, unfortunately, there is a lot of misinformation about the vaccines right now, or maybe a lot of information that is not understood. What we're really trying to do is trying to relay the information that A, the vaccines are safe. The vaccines have a degree of effectiveness.
Luke and Amanda have been dating for a year and a half. Luke has a weak immune system and doesn't receive vaccines. Anna gets her flu shot for him.
I think it's just good to think of other people, even if you're in good health, he can't get vaccines because of his immune system, and I think it's just my responsibility to make sure I'm noting how I'm feeling and making sure people people who are immune compromised are staying safe too.
I appreciate people like her who do that, and I encourage it. I want to encourage it.
And while flu shot numbers are generally down around the country, Mark and Aaron, Connecticut is doing very well. More than 1.1 million people in our state have received their flu shot this season. I'm your reporter live in Middletown tonight, Dylan Fear, Channel 3 Eyewitness News.
Dylan, thank you. Joining us now, Dr. Omer Awan, senior public health contributor for Forbes, to talk about this super flu, Subclade K. Thank you for your time. So does the flu shot still make the symptoms of this variant less severe? What should we know?
Thanks for having me, Marnie. Well, the flu shot isn't a perfect match for this Subclade K variant that you all are talking about, but it is some protection, and some protection is better than no protection. That's why it's still critical that we all get vaccinated. And the reason for that is because the purpose of vaccination isn't necessarily to prevent you from getting the flu, it's to prevent you from getting sick or to get hospitalized. So that's why everyone, according to the CDC, that's age 6 months and older should really get this flu vaccine.
Lessen your risk. So this particular variant, what more do we know about it? Are the symptoms the same? Are they worse?
The symptoms are the same, but they're more severe. So you're going to get a fever, sore throat, runny nose, cough, body aches, but they may be more severe. So the fever may be higher temperature, or the muscle aches and the body aches may be more painful. So that's why this is concerning, because it's more severe symptoms, and then it can also lead to increased risk of hospitalization. Sometimes the complications can be worse. So you may have a higher propensity to be dehydrated, maybe more likely to go to the hospital if you get this. So very important for us to be vigilant and to try to prevent getting the flu to begin with.
You know, the flu vaccine is already out there and people are getting the shot. Is it too late to add this somehow to the vaccine? How long does that typically take?
It's not too late to get the flu shot, so I recommend everyone out there, if you haven't gotten the flu shot, please get the flu shot. Usually immunity takes about 2 weeks for your body to respond and to form antibodies so that you're protected against the flu. So remember, peak flu season is really January, February, so we're only in mid-December. So in fact, Marnie, this would be a perfect time to go and get the flu shot. So I recommend everyone go and get it.
And I'm also wondering just about this particular variant, how they can add it to the shot to help build immunity. Is that usually a process that will happen after the flu season ends for next year's flu shot to include this variant?
Possibly. What ends up happening, Marnie, is that usually around February, public health experts come and convene and try to formulate the formula for the flu shot. So this is why the Subclade K was not in this flu shot, because remember, Subclade K started and was detected first in June, well before the flu shot was actually formed already. So this will certainly be taken into consideration for next year's flu shot, but unfortunately, the actual Subclade K is not included in this flu shot, but the H3N2 form is included, and the Subclade K originates from H3N2. So this is why there is still some protection, although it's not a perfect fit.
Yeah, get your shot. It's on my list of things to do. Wash your hands. We hear that all the time as we go into the winter season. We should be doing that all the time. What else is your advice for people to stay healthy right now?
Well, I want to start with washing hands, Marnie, because not just washing hands, but washing it for 20 seconds. And that's often a message that we don't hear often enough. It's hard to wash your hands for 20 seconds if you think about it. So that's number one thing, but also just avoiding sick contacts, staying sick at home when you are sick, avoiding confined indoor areas. And if you do have to go to an indoor confined area, please, consider wearing a mask, particularly an N95 or KN95 mask. We know that masks help prevent transmission of diseases. And I love that you're washing your hands right now. So that's absolutely great. I love the messaging there.
Do your part, right? Wash your hands. If you're sick, stay home. Yeah, we can all stay healthy if each one of us does a little bit to help. Dr. Awan, thank you. Happy holidays. Healthy holidays to you and yours.
Happy holidays. Thanks.
Seeing the emergence and the rapid expansion of a new H3N2 virus subclade called J.2.4.1, aliased as K. The subclade K virus was first noted in August in Australia and New Zealand, and has since detected in over 30 countries. Current epidemiological data do not indicate an increase in disease severity. Although this genetic shift makes a notable evolution in the virus. From the flu perspective, from the respiratory surveillance and preparedness perspective, certainly we would need all the countries in the world to participate in the surveillance, preparedness, and the response for influenza and other respiratory viruses, because we don't know the next pandemic, the strain, when and where it would emerge.
What if I were to tell you that your non-compliance was required? Not only was it required, it was essential part of the planning, because now through your non-compliance you have earned the label of dreaded spreader, and you are now responsible, or now can be held responsible and blamed for the spread of this particular virus. And you know, we've heard the phrase dreaded spreader in previous videos regarding Subclade K, and just as they took it upon themselves to actually name the virus and give it a catchy catchphrase, Subclade K, they've also provided a catchy catchphrase for those that are not willing to comply or go along with any requirements or advisory warnings that may be issued through non-compliance. They are now labeled as dreaded spreaders, and they are now the villain of this particular pantomime. And something else you might want to consider as an alternative avenue of exploration is, what if your non-compliance was required in order to ensure that the plan was executed to its perfection? And by executing it to perfection, as you have chosen not to comply and refused any recommended medical preventatory causes or treatments to stop you getting this virus, having been forewarned and refusing to take any advice, it's on you if something bad was to happen and you didn't perhaps survive whatever possible hypothetical pandemic that may lay ahead of you. As I said, guys, not here to alarm anyone, not here to tell you that is exactly what is going to happen. It's just something to bear into consideration, and before we can make up our own minds as what is best for us, it is always good to explore all possibilities, how plausible or non-plausible they may be. And as I said, guys, it is always best to get the advice of a medical professional. I am not qualified to give anyone any medical advice, and therefore do not do so. It is entirely up to you, your body, your choice. But don't resent anybody who may not particularly share your opinions or views, you know, they are fellow victims as much as you and I are. It doesn't matter if you comply or not. They're still going to go ahead and do whatever it is that they have planned for us. So this article from MoroccoWorld.com is 10 minutes old at the time of recording, and it is regarding the World Health Organization, who are warning of a rising flu cases as a new AH3N2 variant spreads globally. And that's Subclade K for those of you who have been following along to this story as it is developed here at NoOneWatchesArDee, and it was first detected back in August of this year, 2025, in Australia and in New Zealand, and the variant has since been identified in more than 30 countries, and within the last 24 hours Mexico has reported its first case. We will get to that article shortly. But Rabat, according to the World Health Organization, in brackets there, the WHO, influenza and other respiratory viruses are currently on a sharp upward trend worldwide, driven in part by the rapid spread of a new influenza variant, which is Subclade K, folks. Speaking at a press briefing in Geneva, Wenjing Zhang, an unusual name, but not the most difficult one to pronounce there, who is the head of the WHO's Global Respiratory Threats Unit within the Department of Epidemic and Pandemic Preparedness, That should cause a red flag to be raised and maybe an alarm bell to ring with some of you there that they're already preparing. It would seem for another epidemic and pandemic, but that's just my opinion. Take it fit or make of it rather what you will. But she said that the current flu season is marked by the emergence of a fast expansion of a new subclade of the AH3N2 virus. This year is characterized by the emergence and rapid expansion of a new subclade of the AH3N2 virus, Zhang said, referring to the variant known also as J241, not as catchy as Subclade K, I must admit, but J241 is another alias that this variant does go by, but it was first detected in August in Australia and New Zealand, as the article started out, and we have established it's now in 30 countries. Zhang noted that current epidemiology data do not point to an increased disease severity linked to the new variant, despite a significant genetic evolution of the virus. Influenza viruses are known to evolve continuously, a key reason why flu vaccine compositions are regularly updated. She explained that the WHO closely monitors these changes, assesses public health risks, and issues vaccine composition recommendations twice a year through its long-established global influenza surveillance and response system known as GISRIS. I think you could say that, but it works. They also work alongside international experts, but the new variant is not included in the most recent vaccines, as we have established in previous Subclade K content. Nobody watches here at NoOneWatchesArDee, but it is produced for the Northern Hemisphere flu season. However, early data suggests that the existing seasonal vaccines continue to protect against severe illnesses and help reduce the risk of hospitalization. Seasonal flu still bites. Seasonal influenza remains a major global health burden, and the WHO estimates that around 1 billion cases occur each year, including up to 5 million cases of severe respiratory illnesses. Seasonal flu-related respiratory diseases are responsible for as many as 650,000 deaths a year. Zhang stressed that vaccination remains the most effective line of defense, and who's to argue with her? She is the head of a department in the WHO, the World Health Organization, so I'm pretty sure she wouldn't have anything malicious to spread when it comes to protecting yourself against the flu. But particularly for high-risk groups and those who care for them, she pointed to early findings from the first study assessing vaccine effectiveness against the new variant, published recently in the United Kingdom. We have seen that report here at NoOneWatchesArDee in previous Subclade K related content, and so far as I can tell, there are very few people outside of the mainstream reporting on this subject, although I'm very aware that YouTube doesn't always provide me with channels that they don't want me to see, a little bit why I don't ever show up in any search results. But according to the WHO, back to this article that is as recent as 10 minutes ago, probably 15 by the time I finished reading it, the results are quite promising, showing around 75% effectiveness against severe disease or hospitalization among children and about 35% among adults. As I said, we've previously looked at that report here at NoOneWatchesArDee, but as you guys know, nobody watches RD. But with the holiday season approaching, this is something we highlighted in the last episode when we had pointed out this is starting to sound a lot like COVID, that the holiday season is a busy time of year for travel and is a sort of time of year where sort of families that might not otherwise throughout the year get together and spend time with friends and loved ones, and get together on other parts of the country, jumping on planes or on trains trains or buses to get to see these family and friends that they don't see for the rest of the year. So, you know, it is ripe scenarios for a disease to spread. But with the holiday season approaching, Zhang warned that increased travel and social gatherings could fuel a further rise in respiratory infections, I was just pointing out. But she urged countries to plan ahead by promoting vaccination and strengthening health system preparedness. The WHO official also called for stronger year-round laboratory diagnostics and disease surveillance, encouraging countries to take part in the global influenza monitoring network. GISRIS includes influenza surveillance centers in 130 countries and around a dozen reference laboratories worldwide. Asked whether the United States would remain part of the network next year, despite its decision to withdraw from the World Health Organization of January 22, 2026, Zhang expressed hope for continued cooperation. From the perspective of influenza respiratory surveillance and preparedness, we certainly need all the countries in the world to participate, she said. We do not know what the next pandemic strain will be or when and where it will emerge, although I do suspect strongly that the new pandemic strain has introduced itself to the world, and it goes by the name of Subclade K, and it has already emerged back in August out in Australia and in New Zealand. And already, you know, Japan, we have heard, is already declared this an epidemic for their flu season. But she added that reducing the time between a virus emergency's detection, characterization and inclusion in vaccines could make a substantial difference in the number of lives saved. And there you go. That was that article from 10 minutes ago. If we click out of here, let's just scan through some of the articles from within the last 24 hours and last couple of days. Here we can see from the US News and World new variant Subclade K, what to know as flu season starts 19 hours ago. A new flu variant is circulating. What to know about influenza in Florida. That came out 2 hours ago from the Miami Herald. The Dallas Morning 4 hours ago. Superflu variant is circulating and raising concern. Here's what to know about it. New flu variant may be triggering a spike in severe diseases. Scientific American 1 day ago. So like I say, guys, some very recognizable outlets and publications are reporting on this. The flu cases are on the rise due to Subclade K. Is it in Florida? That's from Pensacola News 19 hours ago. 2 days ago from Gizmodo. Emerging superflu strain is spreading fast. Here's what you need to know from Fox News 2 days ago. Aggressive new flu variant sweeps the globe as doctors warn of severe symptoms. How dangerous is the K strain of superflu? The week, that is from actually 8 days ago, so a little bit old, but back to within the last 24 hours, WPLG Local 10 reports that there's a flu variant driving a spike in cases as experts advise caution ahead of the holiday season. A new K subclade flu variant is rapidly spreading across the United States. All you need to know, that's from the Financial Express a day ago. Here we see Mexico confirms its first case of so-called superflu variant 2 days ago. Health experts sound alarm on new flu variant Subclade K. What to know in SC? I'm guessing that's South Carolina, and that is from Greenville Online 7 hours ago. What is the new subclade flu variant that is rapidly spreading as flu season surges across the United States? That is from the Times Now 3 days ago. New flu variant raises concerns as Michigan vaccination rates lag. That is from a day ago. So there's Michigan, South Carolina, Florida, we've heard. In here's New York, hit by a very high flu transmission as nationwide cases surge and public health campaigns intensify. 20 hours ago, I'll come back to that one. A new flu variant is emerging, but experts say the current vaccine still offers protection. That's 8 days ago, so nothing new there. 5 days ago, we're not going to read that one. 17 hours ago, we will read. Flu cases surge in northeast Ohio as new variant spreads. That's from Cleveland. This one we will click on because the headline reads, nearly 3 million people have caught the flu. Here's where the virus is hitting the hardest. And this is from WCBD Charleston. Nearly 3 people have caught the flu. Here's where the virus is hitting the hardest. And this is from Alex Martichok's. Marty shows, who knows? It's a very difficult article to read. Continue reading. The US is seeing a post-Thanksgiving spike in influenza, which is again something I predicted that we would see, and possibly the second Subclade K video here at NoOneWatchesArDee. Told you so, folks. But the data released by the Centers for Disease Control and Prevention on Friday shows, there's a pop-up there that we can't get out of the way, but the country saw a 8% or 6% increase in people testing positive for the flu virus last week, according to the CDC. And an estimated 2.9 million people have gotten sick so far this season, and that's about 1,200 people have already died. And I'm not entirely sure if or not flu season has officially started yet. As we've heard, it came 5 weeks early in the United Kingdom, and it has also come early in the United States, it was seen. And now we've seen from this article that nearly 3 million people have contracted influenza, and we've already seen over 1,000 deaths. But several states have also moved up into the CDC's higher tiers for flu activity level. As of December the 6th, the latest available national data show that Colorado, New Jersey, New York, and Louisiana are experiencing high transmission of the virus. There is a video there that you or we can watch. Can we rewind it? Let's not do that. It could possibly cause some catastrophes, but we'll come back once we've read the article and see if we can play that. But the new type of flu emerges. What to know about the new K variant of influenza, and this is from Connecticut, Georgia. No, it isn't. Connecticut, Georgia, Idaho, Massachusetts, Michigan, Rhode Island, South Carolina, Texas, and Puerto Rico have also saw an increase in the spread of virus, landing them in the moderate tier. So a lot of places, guys, as you can see from this, and you can go and look this up yourself if you so wish, and do your own research in looking into this information on your own. All you have to do is go and choose a search engine of your choice and type Subclade K into the search bar. New York City, which reports as a separate jurisdiction from the rest of the state, moved into the most severe category for very high flu activity. And there is a map. You can see some red, green, yellow, and amber places there. And I'm guessing the red one is New York, and that one down at the bottom right-hand corner, I'm guessing, is Louisiana. Would that be Idaho? Centralized there. Excuse my geography of the United States, I'm guessing. But 4 jurisdictions have high flu activity and 9 have moderate flu activity, according to the CDC. So this is in the United States of America, guys. You've got high activity, and New York City, which is a separate entity, is in a severe category. And New York is a place that a lot of people do tend to visit at Christmas time. I know myself in the past visited New York the week leading up to Christmas, and it is an extremely Christmassy place to visit. And some of you may have visited there vicariously through films such as Home Alone 2, Lost in New York, where little Kevin, whatever his second name was left to run amok on his own in New York City, and had a whole bunch of fun doing so. Also contained a cameo from Donald Trump, if any of you can remember that. But much of this season's flu activity is being driven by the new variant Subclade K, and the Subclade is a type of H3N2 influenza. We should know that by heart by now, folks. Those regular offenders who do actually watch RD and tune in to his unwatchable content, but it has historically caused more hospitalizations and deaths. Unlucky for us, I guess. It is not too late to boost your protection against the virus, and the CDC recommends that every 6 months, an older who has not yet been vaccinated this season should get an annual influenza vaccine. The agency said on Friday, the CDC said it has distributed 127 million doses so far. Things are expected to get worse before they get better in the United States, as flu activity tends to pick up in December before peaking between January and March. So as I said, guys, 3 million people have already contracted flu, and it hasn't even sort of reached its peak season. And that is that article reporting that 3 million people in the United States and its territories already have contracted this variant strain of influenza, Subclade K. So let's come and click out, and I'm actually using DuckDuckGo this time, which always takes you right back to the top. So there was an article that I said we were going to come back and read. It was that one, the New York, from hoodline.com. New York hit by a very high flu transmission as nationwide cases surge and public health campaigns intensify. Amid rising flu cases in New York and widespread impacts across the United States, public health officials are doubling down on preventative measures, according to the Daily Mail. The new flu strain identified as Subclade K is causing skyrocketing. That might be something interesting to throw into an anagram generator. If you are watching Break the Spell, work your magic and let us know what that's got to say. It is skyrocketing in cases, and it is skyrocketing earlier than usual. Spikes in flu activity, the CDC has revealed, are very high, and transmissions in New York City for the week ending on December the 6th, with its surrounding areas like New Jersey and New York State also reporting high levels. New York isn't alone. Addressing this concern, schools in various states such as Poly, Prep, County Day in Brooklyn and Villa Duce, that one we couldn't read last time, in Moore, Missouri, have temporarily closed their doors. We found out about that in the last video due to the virus, but taking preemptive action to prevent further spread in a response to the escalating situation. Certain health systems, including Hackensack, Meridian Health, and RWJ Barnabas, again, we heard about them in the last video, have reinstated mask requirements for anyone and everyone walking through their doors. The city of New York is not taking these developments lightly. The health department launched a $1 million Don't Miss Out campaign, as Gothamist highlighted, aiming to combat both the flu and the fear of missing out during the holiday season. So if you don't want to miss out on holiday, they're suggesting that you get your shot. And maybe that might be a little bit of limitations that maybe as we get closer to the holiday period, and sort of people are starting to get on buses and planes, that perhaps you might not be allowed on those planes if you haven't had a recent flu vaccine, is something that I am hypothesizing. But the campaign emphasizes vaccination, hand hygiene, and mask wearing, folks, and general cleanliness to curb the spread of the flu and other respiratory illnesses. This year's dominant new flu variant poses a unique challenge due to its novelty to our immune systems, which makes people more susceptible to severe illnesses, with a hospitalization rate climbing to 6.9 per 100,000 people nationwide. Interesting numbers there, compared to the 4.3 per 100,000 the week prior. As per the Daily Mail report, the urgency to mitigate this public health threat is clear. Health officials are not recommending a flu shot and advising those who develop symptoms to mask up without delay. We've heard this all before, folks. Let me know in the comments where you've heard all of this before. And as we said in the last video, it's starting to sound a lot like COVID. But for anyone that feels ill, Dr. Bernard Cummins of Mount Sinai Health System told Gothamist it's generally a good idea to wear a mask when respiratory viruses are going around, but especially if you have symptoms yourself, even if you're not sure yet whether it's the flu, a cold, RSV, or COVID-19. So there you go, folks. And let's see, again, DuckDuckGo will take us all the way back to the top. And let's go and read that one about the first case in Mexico. And that is where we will leave it, as I don't want this to be a very, very long one. But I am updating on a story that I first broke close to 4 weeks ago now. And it is a story that week by week is increasing to grow and start to speculate a little bit more, or the speculation is starting to grow rather, that this is going to develop into a pandemic, and possibly come the new year we may well be reintroduced to lockdowns and maybe sort of restrictions on people who have not yet been vaccinated for the influenza. Not for me to tell anyone how to conduct themselves through flu season and what remedies or medications they may or may not take. Always seek a medical professional for your medical advice. I'm just reporting and reading some articles that are clearly stating that this Subclade K is getting a little bit out of hand even before the flu season has started. Have I passed it? We read one of those about Boone Country recently. There's the one about Mexico. Excuse me, guys. I'm doing this all in one recording rather than patching together multiple recordings. I'm sure we saw one. Maybe we did pass it. Let's go back. Forgive me. But as I said, at the same time, you can see just how many sort of articles within the last couple of days. Look at this one. A Chinese superflu hits 36 states, and they're saying it's from China. That's from 5 days ago. Iowa school closed after 30% of students fall ill as hospitals reinstate mask orders. So as I said, we're not going to click on too many of these because they do repeat themselves. The WHO warns, that was the one we started out. Flu concerns grow in the United States, and the UK sees more cases among kids. But that was from 9 days ago. Superflu strain is raising early Christmas alarms. Health and Me 2 days ago. Where's the one about Mexico? New flu strain in North Texas prompts shot reminders 18 hours ago. Another one from Texas there. New flu strain mutation triggers early rise in Texas flu cases. Hospitalizations. The WHO warns new influenza variant linked to severe disease surge. Here's what to look out for. That was 8 hours ago from International Business. Whatever that is called. Experts predict this year's flu season to be worse than usual. Here's why. In the Geo 7 days ago. More severe flu variant Subclade K is identified in Boone County. That was somewhere a county, one of the first ones that closed down schools, and they're seeing even more cases. Where is it? Ontario. Here we go. Canada. Ruth, I know you're up there east of Yonge in Toronto, my former home for a while. You said you weren't hearing anything about it up there in Canada too much. Here is one from actually 14 days ago inside Hamilton. What is Subclade K, and is Ontario's vaccine a mismatch for the flu? Why can't I find the one about Mexico? The new mutated flu strain 2025. Media India 5 days ago, so India reporting on it also there. Here it is, health officials, and this is from Mexico News Daily. I got there in the end. Good job, RD. I praise myself. Thank you for your patience. But as I said, give us a little chance to scroll some of those articles that you may want to go and look up and read yourself. But this one from News Mexico is where we will end this today. Health officials report the first case of superflu in Mexico, and this came out December 16th, 2025. With the arrival of superflu in Mexico, the health ministry is recommending that the population make an extra effort to take the precautions associated with the flu season, including flu shots and voluntary masking. With winter around the corner, flu season is underway in Mexico, and the government has reported numerous cases so far of the familiar seasonal flu. AH3N2, one of those cases, has received special attention because it is the first appearance of the H3N2 variant known as Subclade K, commonly referred to as a superflu. The seasonal superflu is highly contagious and can cause severe symptoms. While it is not completely a new virus and is not more deadly than other flu strains, it is infecting a significant number of people in the United Kingdom and the United States and placing stress on healthcare systems. Superflu patients may experience extreme fatigue, often accompanied by headaches, nasal congestion or runny nose, chills and sweating. High fever, generally above 38 degrees centigrade, 100.4 Fahrenheit, can be expected, as well as a persistent dry cough that can last up to 2 weeks. Other frequent symptoms include sore throat and muscle and body aches. The National Institute of Respiratory Diseases confirmed on Friday that the variant had been diagnosed in a single patient in Mexico, according to the INER. The patient responded well to antiviral treatment and didn't show any further complications. Good news about that, and has fully recovered. But as of Tuesday, the INER hasn't reported any new patients carrying the superflu viruses here in Mexico, so it's been the one isolated case so far, but it always has to start with one. But the Health Minister, David Kirsch, that's a strange name, said that the Subclade virus does not pose a threat to Mexico, as the country is equipped with enough resources to protect the vulnerable population against it. Unlike the United States of America, that is already being swamped with over 3 million. But good old Mexico, we're not worried about it. We've got enough enough resources to keep ourselves safe. But we have enough vaccines, they said. And the President Claudia Sheinbaum's daily morning press conference. And whenever someone has the influenza, we have the capacity to treat it with enough supply. But he also added that the government has been administering the Mexinvax vaccine that was developed in Mexico since 2024. Remember, we don't have any GMOs here in Mexico, and many of the things that exist within the United States and Europe have no jurisdiction here. So Mexican has come up. I'm not saying it's any safer or more effective than other vaccine companies that provide influenza vaccines, but Mexico took it upon itself to make its own influenza vaccine that it has more than enough doses of to provide assistance to anyone suffering from influenza this season, which I don't know is a good thing or a bad thing. But as I said, unlike the United States, Mexico is saying it isn't a threat to Mexico at the moment. Let's hope that they are not famous last year words. But Mexico's health ministry noted that the superflu's clinical management is the same as that of any influenza type, and the primary prevention measures continues to be vaccination. These vaccines are effective in reducing risks, preventing complications, hospitalizations, yada, 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 whoop-de-woo, ray-a-tay-tay, especially children and older people, pregnant women, health personnel, and people with comorbidities, the health ministry said in a statement. Health authorities have also said that the National Epidemic Surveillance System, SINAV, maintains constant monitoring to recognize unusual patterns or new subtypes of the virus, allowing for timely intervention in the event of outbreaks. And I believe that is the end of that article. So only the one case so far in Mexico, but as I said, it always has to start with one case, and let's hope that is not famous last words, as I already pointed out that this isn't a threat to Mexico, but Mexico, unlike the United States and the United Kingdom that rely on organizations to provide, or corporations to provide them with their vaccines, Mexico has an in-house one. And there you go, folks. That is where we will leave it for this evening, although let's just kick on the all section, because this one also, DuckDuckGo, also provides a little AI overview of a topic you search for, and it says pretty much exactly what we know if you have been following along. Here are some of the symptoms to look out for, and it is telling you to get the vaccine. Here are the age groups of its effectiveness. It's most effective for children. You've got a 50-50 chance, more or less, if you're 18 to 64, and about a 60% chance to 70% chance of reduced symptoms if you're over 65. So there you go. I'm not going to read any of that because we know, but it's suggesting on its closing article that around the holidays, preventive measures include frequent hand washing, cleaning, high-touch surfaces, staying at home if sick. But DuckDuckGo AI isn't recommended that you mask up yet, but quite a few articles and organizations are suggesting you do so. So that's where we will leave it for today, folks. Hopefully you have been informed. If or not this was enjoyable, I neglect to think that it would be. It's not exactly a very enjoyable topic, but your viewership, if you have watched RD this afternoon, this evening, or this morning, whatever time of day you are watching, I do appreciate your viewership, and again, thank you for watching. That being said, folks, until the next time, remember to be excellent to each other. May the force be with us all, and take care until we see each other again. This is RD signing out for now.
Sit, Ubu, sit. Good dog.
Be excellent to each other. Party on, dudes!
Hey, Luke. May the force be with you.
All right. Take care now. Bye-bye then.